So I've been saving the best for last. This is reason number 5 for back pain, and that will be neuropathy. And not just any neuropathy, we're going to talk about different types of neuropathy. Neuropathy is essentially nerve damage or some sort of injury that's happening to the nerve tissue. So the first type of neuropathy that we're going to talk about is something called mononeuropathy. So this type of injury is essentially a peripheral nerve condition where the injury itself is taking place outside the brain and the spinal cord. This may result in symptoms like sciatica, where people feel traveling sensations down the leg. It could result in lower back pain. It could result in any kind of traveling sensation anywhere in the body, depending on which nerve is being compressed or injured. And these type of injuries usually affect a single nerve, and that's why this is called a mononeuropathy. So it relates to a single nerve. It could affect the entire branch of the nerve. So for example, the sciatic nerve might be compressed around the piriformis region, where is the around the buttocks. Or it might be compressed down around the knee. Let's take sciatica for example. This injury essentially results in a lot of nerve pain traveling down the leg, sharp shooting pain to the lower back, into the buttocks region, into the hamstrings, all the way down to the foot. Now there's different stages of this and there's different reasons as to why you might be getting sciatica. But when it comes to mononeuropathy, if the actual sciatic nerve is being compressed by muscle tissue, then we're not really talking about the actual condition sciatica. This is something completely different. You're only getting symptoms of sciatica. And this is where something called Piriformis syndrome comes along. Piriformis syndrome is where essentially the sciatic nerve is being compressed by the piriformis muscle. This is not sciatica. These are basically symptoms of sciatica as the condition. When we're talking about sciatica, this is essentially something called a radiculopathy, a pinched nerve, as that's what most people know it as. There's actual compression of the nerve root. Now the nerve root, when the nerve root is being compressed, then the entire nerve and all the branches that connect into this nerve root are going to feel this compression. If there's a root that's being pinched due to shrinking or some sort of a condition happening to the actual vertebra, like stenosis or some sort of a bulging disc or herniation, this is where we get in the so-called radiculopathy, when the actual nerve root is being pinched, it's inflamed. This is the main difference. So when it comes down to mononeuropathy, if, for example, the sciatic nerve is being pinched somewhere along its pathway down the leg, so if, for example, if the piriformis pinches it, then basically you're going to feel symptoms local to that area, and then something like sciatica traveling down the leg. But then if you actually pinch the nerve root of the sciatic nerve, then it's going to be excruciating pain, needle-like pain, sharp shooting going everywhere, pain that wouldn't let you sleep. The second type of neuropathy that we're going to talk about is something called polyneuropathies. So this is where multiple nerves on both sides of the body are being affected, and most of the time this is happening due to some sort of a condition or a disease. And finally, we're getting something that is not really as common as the other three that I've just mentioned, and this is something called myelopathy. But when it comes to myelopathy, we're talking about compression of the actual spinal cord. The spinal cord that controls everything, so that itself can be compressed due to some sort of a narrowing of the spinal canal. Knowing all these different types of neuropathies, let's have a look into the anatomy as to how any kind of nerve compression can be causing back pain, and which are the main nerves in the body that will be causing back pain. Now I've removed a lot of the tissue that essentially covers the sciatic nerve, starting with the glute max and the lower back muscles. All I've left there is the piriformis muscle that essentially is on top of the sciatic nerve. So you can see how close that is to the actual piriformis, and how easy it is for the piriformis to essentially compress onto that. Deep into that pelvic region, you can see how many nerve fibers you've got there. So all these nerve fibers will then connect into the main body of the sciatic nerve. So when it comes to the sciatic nerve, we've got two main branches. That's the tibial and the peroneal, or the common fibular branch. And now let's trace the entire sciatic nerve by removing the hamstring muscles and then moving down into the leg. So if I remove the hamstring muscles, you can see the main body of the sciatic nerve. So it's well hidden behind the two main heads of the hamstring trio. It goes down into the back of the knee, and then it will split into its two main branches, which will be the tibial and the peroneal branch. Goes down into the calf and then basically goes underneath the foot. So it actually takes the shape of the leg. So all these nerve endings that you can see that actually resemble a foot, all of them are essentially controlling a muscle that controls a toe or some sort of movements in the foot. And that's how fascinating the nerves are, because essentially if I remove the muscle tissue, you're going to be able to see your entire body made up of little yellow branches. The second biggest nerve in the lower body, the femoral nerve, will again start from the lumbar region of the body, very close to the sciatic nerve. The femoral nerve would then descend down through the something called the psoas major, which is a major hip flexor and the only muscle that connects the upper body to the lower body. You can see how it goes underneath something called the inguinal ligament, which is a band of tissue that connects your pubic bone to your pelvis. It travels down the entire quad, so it gives the function to the quad. I'm gonna finish off this femoral nerve with its saphenous branch. This is the nerve that goes down on the inside of the leg and provides the function, the motor function and sensory function. Finally, you're gonna see the full shape of the femoral nerve once I've taken away everything else. The nose is big as the sciatic nerve, but still you can see how it gives the quad its shape, and then you can see the saphenous branch traveling down on